Before we commence the live session, I would like to request your cooperation for our quality assurance process. It is imperative that the framings of doctor's video meets our quality standards. Therefore, I kindly request you to maintain a stable position and ensure proper camera framing throughout the entire session. Additionally, please refrain from engaging in any other activities while the recording is live. Furthermore, in the event of low network bandwidth, I recommend sharing your presentation from your laptop. For verbal communication, kindly join the session using your mobile phone. Your adherence to these guidelines will greatly contribute to the overall quality and effectiveness of the recording. Thank you for your understanding and cooperation. We will go live in a minute. Greetings and a warm welcome to everyone. I am Hafsa, the assigned moderator from Clirnet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country. We are indeed fortunate to have the valuable support of the esteemed doctors, and I express my gratitude to each one of you for dedicating your time to with us today. Allow me a moment to introduce our platform, Clirnet. It stands as one of the largest live digital CME platform in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Amitav Banerjee, sir, who holds a degree including MBBS and MD, along with a postdoctoral epidemiology from Dr. D.Y. Patel Medical College, Pune. He serves as the chief editor of the medical journal of D.Y. Patel Vidyapith, and he is also an academic editor for PLOS ONE. Once again, I welcome you all of today's lecture for topic vaccination campaigns for preventable diseases, strategies for enhancing immunization rates and coverage. Well, I would like to take this opportunity to provide a brief overview of today's topic. Vaccination campaigns are designed to optimize immunization rates and coverage through targeted strategies. Enhancing public trust in routine vaccines is essential for cultivating a robust vaccination culture. Initiatives such as catch up vaccination programs observed during events like National Public Health Week and World Health Day address gaps in immunization. Integrating vaccine service with programs for women, infants, and children facilitates broader access to immunization. Home visitation programs can augment coverage among undeserved population by delivering vaccines directly to those with limited access. Without any much further delay, sir, I would like to hand over the session to you. Kindly proceed with the talk. Over to you, sir.
Thank you, Afsa, and greetings from D.Y. Patil Medical College. It's a pleasure to come on the Clirnet platform. And today we'll be discussing a challenging topic, that is how to rebuild the public trust in vaccination. Because until unless we communicate with the common person, the long-term uptake and long-term coverage will be adversely affected. And the trust has to be built up. And these will be the discussion points today. And we cannot overlook the fact that views on vaccines of late are getting polarized. There are two camps. One are very strong advocates and one are totally against all types of vaccination. So this is something which is unfortunate for the good coverage or good public health. And we have to weigh the benefits and risks from vaccines. And we have to be sensitive to personal experiences of people. These perspectives form from personal experiences. We'll be discussing that. And one must respect the other person's views to avoid polarization. This would be one of the, yeah, because strategy, you have to think of the psychology of the common person, psychology of the masses. No one has the final answer to vaccine effects. We have to admit that. So we should keep on exploring together. Vaccine mandate does more harm than good. We will discuss on that. And propaganda and publicity do not sustain. Of late, we are trying to use social marketing techniques. So vaccines are medical interventions. They require a scientific basis. So the propaganda through film stars and other celebrities do not sustain in the long term. Then what sustains in the long term, we are going to discuss. That is transparency, empowerment, and accountability. So this would be the scope of our talk today. And what are the eternal debates? No other medical intervention generates as much debate as around vaccines, and which is getting more heated. The powerful tools are double-edged. Vaccine proves the point well. Vaccines have helped as well as harmed, depending how thoughtfully they were deployed. A strong weapon is double-edged sword, so one can harm also. So we have to be very careful. Regret views on vaccines are getting polarized instead of being balanced. So today we will try to give some balanced messages which can be communicated to the people so they are empowered and they take their own decisions which are in their benefit and benefit of public health. So the Shakespeare, the bard, has captured all philosophies and dilemmas of human life. So this is a phrase from Mark Antony's speech in Julius Caesar. The evil that men do lives after them. The good is often interred with their bones. So this is true for vaccines as well as humans, because the good that vaccines do are not recognized because the outcome of a good vaccine is a non-event. That is, there is no disease. But if there is even a rare side effect, that is the evil part of it that remains after them. So this is the psychology we have to keep in mind, and this is what we are against. There have been some. This pandemic has created a lot of mistrust because the adverse publicity and around the pandemic and because of some sort of a global panic, vaccines were pushed very fast, vaccines were mandated, vaccines were coerced, people were forced to take vaccine by hurried nudges, and it boomeranged, it backfired. And because it backfired, because after some time we came to know the immunity does not last long, and since the billions of people were covered, even rare side effects they accumulate, and then it gives the adverse publicity, and subsequently like myocarditis, blood clots gradually, even though rare, but when billions are vaccinated, it creates a lot of distrust of vaccines, and even against other vaccines which are well tested vaccines. So this is the tragedy of the present times, that across the board, so there is a, and so this is something. And then, as I had already said, perspectives vary. Depends on personal experience. Two men may look through the same bars, but one sees mud and the other may see stars. That conveys the idea that people don't see things from the same perspective. So when you are communicating with the common person, when health workers, ASA workers, as Hafsa said, you are going to the community, you are going to the house to mop up operation and all that. The health workers should be trained to communicate. You see, the vaccine is just one part of it. To delivery and acceptance depends on the transparency. To communicate well, to know the side effects well, to know the benefits well. Perspectives are shaped by personal experiences. Health workers in underprivileged regions may witness numerous vaccine preventable child deaths. So health workers who are in the front lines, they see the deaths, while affluent communities might not encounter these deaths, regardless of vaccination status. You see, as status improves, as you are sheltered, you don't see deaths from disease, but you may see a rare side effect from a vaccine. So that will color your perspective. So health workers, when they are communicating, they have to make it tailor-made, culture sensitive, and perspective of the other person. So I am of the personal opinion that this term vaccine hesitancy has been stigmatized. This is not good. And in fact, vaccine hesitancy is a good thing. I mean, even the WHO says the vaccine hesitancy is a threat. It is not that. In fact, it is a trigger for opening the debate, opening the discussion. When asked upon views of vaccine, the response as far as my personal is concerned, I tailored it to the person. To a strong advocate of vaccine, I stress on possible side effects from serious. All vaccines do have any medical intervention. We cannot blindly push it under the carpet, because when we do that, we lose the public trust. So we can discuss it. Calculated risk. How strong is the evidence of efficacy and efficiency? I would like to ask the advocate. Where are the evidence base? Because we are living in modern times. What are the alternatives? Are there treatment available? Suppose it's not given. So to a strong advocate, I pose these questions. And to a person who is totally against all vaccines, I ask this, I give this triggers. I emphasize the benefits of proven vaccine. I show them the data. That is how some simple data charts can be made for the health worker. Give facts and figures about mortality and morbidity risk of the disease. And you have to have that. Leave both parties agitated, vaccine hesitant. I would like even the strong advocate become hesitant, and even the you become hesitant. Science has residual uncertainties. Vaccine has to be based on science, and science does not have final answers. Science has residual uncertainties. Certainty tends toward faith, not science, and it gets hijacked by manufacturers, by politicians, by other people, stakeholders. So it has to be hard science, and hard science is never hard because it has uncertainties. So the one has to really negotiate and calculate at individual population level, at individual level, community level. So I would like to bring to notice one recent publication just in a couple of months back in July in New England Journal of Medicine. This publication is one of the co-authors is Stanley Plotkin, and my medical colleagues will be very much conversant with the standard book Plotkin's Vaccines. This is the eighth edition, and there is a paper titled Post-authorization vaccine safety research requires adequate and timely funding directly linked to the introduction of new vaccines, just as vaccines for children and vaccine injury compensation program funding is. So the title is Funding Post-Authorization Vaccine Safety Science. These authors, which includes the last authority on vaccines, Stanley Plotkin, even he has expressed hesitancy that most of the vaccines are undergo clinical trials with small sample sizes with limited follow-up period. So there has to be robust funding for post-marketing to find out any adverse events in the long run. That is also an important part of building trust. It is good science and it is good strategy for increasing the vaccine uptake. So these are the main points from the paper. The widespread vaccine hesitancy observed during the COVID-19. That's what I had started with. There was a lot of chaos and anarchy during this, and vaccines were just pushed down the people. Suggests that the public loses trust, no longer satisfied with the traditional safety goal of simply detecting and quantifying the associated risks after vaccine has been authorized for use. So it is a very short term provisional, and these vaccines were emergency use, they were not long term. So naturally, so unfortunately, the trust of other established vaccines which have been there for decades are also gone down in many parts of the world. The public also wants authorities to mitigate and prevent rare but serious adverse reactions which no longer seem rare when vaccines are given to millions or billions of people. So this is very what I was trying to stress at, that when you give a large scale, there will be side effects which will be genuine side effects. I mean, which will be many people will be affected who would not never have got the disease, or even if have got the disease, never have succumbed to it. So this is the difference between a vaccine and a medical intervention, other medical intervention, because vaccine you are giving to healthy people. So healthy people, any risk or any adverse events or death is a bigger tragedy than a medical intervention you are giving to an already sick patient who has got some risk of succumbing to the disease. But here you are giving it to a totally healthy person. So this perspective, in our enthusiasm, we should not forget that. Addressing this in a transparent manner will increase vaccine uptake. So we have to be very sure. Nobody has the final answer. So this is from the same paper. This he has said that they are associated vaccine adverse effects, and there has to be research to find out the biological basis of it to really make it safer, all the existing vaccines. So he has listed some vaccines with known side effects. First, he has listed the oral polio vaccine, the authors, I mean, including Plotkin. So there is some risk of vaccine-associated paralytic polio. In fact, what happens when the disease is there, the public sees a lot of cases of paralysis, a lot of cases of deaths from a disease. So they understand that vaccine occurred. But after the vaccination is rolled out, there won't be any disease. As I said, there will be non-events only, and there will be side effect of the vaccine. Then people will start losing trust in the vaccine. So nowadays, most of the polio, because of the wide coverage, most of the polio have been associated with oral live vaccines because it's a live vaccine and understood the mechanism. Understood the mechanism is that since it is a polio virus, which is attenuated to remove the virulence and then given to the drops are given to the child. But since it is still live, though attenuated, sometimes some particularly type 2 or one of the strains, it reverts back to its original virulence, and that can cause paralysis. So this is understood, and that is why nowadays they are gradually shifting to the injectable, which is a killed polio virus, so that this side effect can be eliminated. So this is one example. Then there is other vaccine, swine flu vaccine, which causes Guillain-Barré syndrome, which is not understood. We require more research, according to the authors. Rota vaccine, Rotacil, intussusception, the telescoping of the intestine in some infants, and it is not understood. Important for developing countries in remote areas. If there is intussusception, there may not be surgical help to treat the surgical emergency. So in this rotavirus, these are the outstanding research areas. Inactivated intranasal influenza vaccine causes Bell's palsy. Hypothesized the biological mechanism, but uncertain. Pandemic influenza vaccine, narcolepsy, not understood how it causes. mRNA COVID vaccine, myocarditis, as you are well aware. The association is there, but not understood. We require more research. And young people getting myocarditis is certainly not good because they have the least risk from actual COVID. But if a vaccine, a healthy person, as I said, is unfortunate. And then AstraZeneca, which was very much in the news and in India mostly, we have used 80% AstraZeneca, thrombosis and thrombocytopenia. Hypothesis was uncertain, the clots. So, and this ultimately the manufacturer, AstraZeneca, had to withdraw it. So this again causes erosion of trust. Then AstraZeneca also causes Guillain-Barré syndrome, not understood. Then Pfizer's respiratory syncytial virus vaccine, again Guillain-Barré syndrome. So these are the outstanding which requires further research according to the authors of this paper in New England Journal of Medicine, published in July, couple of months back. 2024, and Plotkins, the authority on vaccines, is one of the co-authors. So here, that means they are expressing some hesitancy that we do not have the final word. And I don't know whether we label them as vaccine. We cannot stigmatize vaccine hesitancy. Now, the other part of the coin, that is those who are skeptical. So I will, this is from CDC figures. So this figures can be discussed with them to show how many diseases have come down drastically after introduction of vaccines. Like 20th century morbidity from smallpox was 48,000, and in the 21st century beyond 2000 it is zero. So 100% reduction. We have eradicated smallpox, in fact. Then diphtheria from 1,75,000 plus to just 4 cases, 99.99 reduction. And similarly, measles, we have got 98.98 reduction in measles. And mumps also 99%. So most are pertussis, so 100%, 99, congenital rubella syndrome. Tetanus, of course, we have to continue taking because it is in the soil. We cannot eradicate. H influenza to some extent, 99. So this is the scorecard of vaccines. And of course, there are some proponents who say, no, it can just without vaccine also things came down. This morbidity, mortality came down in developed countries and all that. But the data is not very strong. In fact, we'll discuss that in the next slide. So uh, proper communication to community, more needs to be done to properly inform the public. Some people don't take the vaccine and we blame them. Stigmatizing is bad because then they go into the defensive. And you also cannot be very sure that all vaccines are safe or it is safe in everyone. We should not treat people like children. For long-term trust in vaccines, people are smarter than the average doctor and need the full information. Average doctor is busy seeing patients. People are smarter. They are seeing the internet. There are a lot of information available. Summary information can have flaws and can be exploited by anti-vaxxers. So this is important. Be truthful and detailed with full referencing of publicly available data. As I said, I have shown this data where there is more than 99 to 100%, 100% fall in the diseases, most of the communicable disease of childhood. But there are some proponents who say this has occurred, otherwise also it could have occurred, but particularly one of the famous one is William Farr, the one of the statisticians of a UK health officer. But those are ecological data. And another thing, most of the hygiene sanitation will improve the conditions and it will bring down the bacterial diseases, experimental disease like diarrhea, dysentery and all that. But the viral disease, the respiratory infections are not amenable to control just by hygiene and sanitation. So that is one thing. And then, as I said, we'll discuss some myths against vaccine which need addressing. Sanitation eliminated most diseases, so vaccine not needed. This is some of the proponents say. This was proposed among others by Sir William Farr, one of the founders of medical statistics. May be true to some extent. Yes, to some extent, but cannot be relied totally, particularly for viral infections. And of course, it is true for, see, this virus or pathogen is one aspect. Other is the host factor. So if the nutrition is good, if your environment is good, your ventilation is good, even if you get the virus, you don't suffer from it, you recover from it. So that way, to some extent, it is correct. But you have to see in most developed countries like India, Asia, Africa, we have not reached that stage of sanitation. In fact, our sanitation today is just what sanitation in the Second World War in Europe. So we are still having a lot of experimental disease we are not reaching. And still, in spite of a poor sanitation, our vaccine preventable diseases have come down. So that shows ki it required. So you have to judge the situation. Indian example, sanitation not improved, but infant mortality rates has come down after childhood vaccination. Nobody can deny that. There is hard data for it. And of course, as I said, there are unfortunate instances also. Then there is another myth because what happened after this pandemic that the other systems of medicines like Ayurveda, homeopathy, they are of the people have a year that this vaccination is they are hostile. I mean, there is no basis in our traditional medicine systems or ancient medicine system of vaccination, which is again false. Ayurveda has no philosophical opposition to vaccination. Scholars like Bhaskar, Ghanekar, and Pandit Shiv Sharma have shown how the idea of vaccination is in harmony with classical Ayurvedic view. Practice of inoculation against smallpox had been in existence for hundreds of years. Instead of vaccine, they used to use the crude vesicle fluid from the vesicles from the lesions and injected in and immunity. This is from a paper by Krishna GL. He's an authority on Ayurvedic. He is a scholar, visiting scholar of ISER and Ashoka University. The Ayurvedic view on immunity and vaccination published in the Indian Practitioner January 2021. So it's not anathema to Ayurveda, the vaccination. Only thing is like with modern research, it is instead of the crude methods they used to use in the ancient times, we have got more refined methods. Then in homeopathy, the whole concept of homeopathy depends on like cures like. According to homeopathic understanding, what a substance is capable of causing in attenuated form, you attenuate it, make it less virulent, it is capable of curing. And homeopathy goes to the lot of other extremes, it high and higher dilution. Whatever it is, it on the same principle, the vaccines are made from the virus or pathogens and remove the virulence. So the like cures like that virus which causes disease in a diluted form, attenuated form, that only prevents it. That is the homeopathy. Then other way around also we have to say some myths among overuse of vaccine is highly strong advocates. Nuts which was used in the COVID pandemic is bad strategy, presumptuous on part of experts that they know best. The speech of anti-vaxxers should not be curbed. I mean, this sort of censorship, misinformation, lot of things happened in the chaos of the pandemic. This increases the distrust and opposition and pushback against vaccines. So this should be avoided in future pandemics or whatever in day-to-day conversation also. Very obnoxious anti-philosophy and anti-science, this type of censorship. It's we are in a democracy, we are in a free world. Really knowing something demands giving reasons and answering objections. You have to listen patiently, respectfully to the other person's view. The way to refine the skills is to encounter and take seriously people who honestly object to our views. It is often the case that your views are only partially true, which is even the Plotkins is also and his co-authors are also admitting that we don't know. We are partially true. We don't know post-marketing research is required. Similarly, people's views are also partially true. The other party is also partially true, are also partially true. So one should engage disagreement respectfully. Obviously, mandates should never be resorted to. So what are the 10 reasons why mandates are bad? Vaccine is medical treatment, cannot be compelled. If a vaccine works, people will take it in their own interest. If you give the full information, if you convince a common person with common sense, will definitely weigh his or her risk and benefit and will take it. If they have to be done mandate, means you have not done your homework well or you don't know what you are promoting. Mandates are not needed even to eradicate disease. Even smallpox. Smallpox did not go by mandate. It went like even by isolation, containment, and ring vaccination. Even Henderson, he says before Henderson, a lot of people tried to eradicate smallpox by smallpox mandates. If you read the history of smallpox, never worked. The pushback was there. But when he go went for focus, and there is no disease which requires 100%. It's a myth that to eradicate disease require 100%. It is not like that. You see, even if you achieve 80%, 70%, disease, most disease can be eradicated because you are not factoring in the many people develop about 20% more or many people more will also develop some sort of natural immunity. So it will 80% vaccination will cover the whole population. And you don't expect more than 20% anti-vaxxers in any community. So you don't have to go and chase them and drag them and hold their hands and deliberately inject them, which is a violation of human rights. And that doesn't need to do that. There are enough people who will accept it. At least you will be able to reach 70, 80% of the people will accept the vaccine if you explain to logically. Others you can explain and then leave it ultimately to their own call. You don't have to force them. There is no disease for which herd immunity is 100%. Once marginal cost and natural immunity are included, there is absolutely no case of mandates. Human factors don't work and always breached. False certificates, so many, then black market starts for counterproductive, longer term harm. People lose faith. Incentives for pharma to bribe politicians and policymakers. You see, they will bribe to bring the mandate. They will bribe the policy. So it should not be in the dictionary because then you are opening to other lobbying and profiting and they are also vaccine production takes a lot of money investment. So I don't blame the manufacturers. They are doing their own for their shareholders. But as scientists, we have to be very, very clear that yes, this is only we should science should dictate the policy or the strategy of increasing the uptake, not commerce, not politics, not mandates. Breach of human integrity and liberty. These are the reasons, strong reasons that we should never have mandates in future. And what are the conclusions and the way forward to restore public trust in vaccines and more importantly in public health institutions should focus on transparency, empowerment and accountability. Science instead of politics or commerce should guide strategy. Using film stars and celebrities to promote vaccine is social marketing and not science. And sometimes it leaves a bad taste like a starlet faking her own death. Experts and institutions with conflicts of interest should not influence vaccination policies. So this is again a gray area which requires attention. Sound public health infrastructure enabling robust adverse events following immunization monitoring, without which rolling out mass vaccination is like running super fast trains on old rickety tracks. And this is a problem in our country. To have AE5 monitoring, you should have the public health infrastructure, you should have a primary health centers, community health centers, which should be well staffed, which is not there at present. And the health workers should be aware of the pros and cons of vaccination to guide, counsel the people who come there. So without all this, without the railway platforms, without the railway tracks, you cannot run fast trains, which we are trying to do in our haste. So this requires thinking, the strategy. They are not shortcuts. They are not film stars and celebrities who will announce and all uptake will increase. They will require railway platforms. You require railway tracks, like you run a train. So platforms are the health centers, the public health infrastructures, which are coming down. They are in very bad shape. Revive public health institutes like Kasoli, Pasteur Institute, Kunur, etc. Earlier, before the I think 2000, in the till the 1990s, the vaccine manufacture was in the public sector in Kasoli, Pasteur Institute, Gundi, and other places. In fact, I was in the armed forces. That time we used to get the armed forces vaccines. We had to vaccinate our troops against typhoid, amongst tetanus, against all those. Yeah. And I remember I was that time leading the epidemic investigation team. There was a big outbreak of typhoid in 2002 in one of the regimental centers. More than 100 cases at a very short period of time, couple of weeks. And we went to investigate. It turned out it was a typhoid outbreak, largest outbreak ever reported. And it's a published paper. And what was the reason is because for 3, 4 years, we were not getting the typhoid vaccine because the Kasoli and other institutes were closed. They had closed. They had stopped manufacturing the vaccines because they had some quality issues. And the troops started getting outbreaks of typhoid, and one young soldier died of typhoid. So as I said, when you see a death from a vaccine prevented disease, you require, it's a very painful. And of course, there are deaths of adverse events also. It's painful both ways, and that is more painful in fact. So then, of course, after that, the vaccine manufacturing, countries with the private industry. So they have their own conflicts of interest. They have the commercial motive. So we have to revive it for a balanced vaccine policy. This is the least we can do to bring back public trust and improve coverage of essential vaccines. Take home messages. As a country develops, most diseases come down, and some due to vaccination as well. I said, yes, as a country develops, but we are still struggling with our development. On the other hand, less privileged regions, vaccines have important role. The issue is nuanced, and taken out of context, it gets polarized. So there is no hard and fast answers. Perspectives formed from personal experiences, which you always remember, because this is a understanding the other's mind is more important in behavioral psychology and how to communicate. Without knowing the psychology, you cannot communicate. I have seen vaccine preventable deaths which haunt me. I have met parents whose child got maimed or died due to vaccine, and that latter haunts me more because, as I said, the healthy person you are giving, he or she would not have got the disease in the first place. Second place, even after getting, he may not have succumbed from the disease, but he or she has succumbed from the vaccine. So it's a big tragedy. So we have to be extra careful, 10 times careful before promoting new vaccines. And as Plotkins and his co-authors have said, we require post-marketing. Most of the vaccines are going on for ages without any post-marketing research. And now we are giving so many vaccines, like the number is increasing. So it would be difficult to know which vaccine is causing any side effects. It's something like, if I have given example of railway platform or railway tracks. It's like having number of flights landing in an airport, busy airport, and without the air traffic controller. So air traffic controller is more important to coordinate the flights than the pilots. So we are having adding vaccines, adding the flights without having the expanding the air traffic controller. So we have to be very, very judicious when recommending a new vaccine. We have to weigh the cost benefit, the risk, whether we'll be able to monitor the adverse effects, if any. There are no easy answers. We certainly need more serious scientists doing serious research to resolve these issues instead of frivolous celebrities and movie stars promoting vaccines like Thumbs Up or Coca-Cola. These are serious business, vaccine. Scientists and doctors should, with science. And in fact, there are many celebrity doctors also who start talking through the hat. So that also should be curbed. Ensuring transparency, empowerment. You have to empower the people, take the decision. You give the facts, it is empower them, not coerce them, not stigmatize them, not force them to act. That is not empowerment. That is against human dignity. You will backfire. And accountability. If there are some adverse events, you have to be accountable. Somebody has to take responsibility. Insurance, government, manufacturer. Now, in the case of COVID vaccine, the ultimately government said it was never, we never mandated. Then who takes the responsibility? So there, people lose the trust. So this type of things we have to think in for future strategy. And I think lastly, I've got some references. This first one is from that New England Journal of Medicine, where Stanley Plotkin is one of the authors, which says that we require safety studies after the vaccine is in the market. Then this is Ablog, never vaccine mandates. Is a small paper in which it is from India Policy Institute, where he has strongly advocated against vaccine mandates. Then this is our column I wrote in the Telegraph for education of the masses. These some of the thoughts which I presented. Then another column which I wrote for Double Helical on the vaccine facts, myths, faith, facts, and myths. It's not faith. Science should not be faith. Fear is also, but facts are the true science. Then this is a paper I wrote with my student rather, which shows that during the COVID pandemic, other vaccines uptake came down, like measles vaccine came down, and there were outbreaks of measles in some of the slums, and particularly in Mumbai. So there were many reasons. First, people lost faith, and secondly, because of logistics, all resources were diverted to COVID. So there were important vaccines were neglected. So this is something which we did a study also and found uptake went down during the panic of the pandemic. So this also strategy we have to say there should be no interruption whatsoever the pandemic, because every day we lose more than 2,000 children every day in India, because most of the disease may be vaccine preventable. A pandemic, we are unnecessarily afraid, but daily we are having pandemic day in and day out. This is Plotkin's vaccine 8th edition. Krishna GL, I have said, the Ayurvedic view on immunity. Hahnemann, organon of medicine, because the concept is similar to vaccination concept. Then this is a outbreak which I investigated. I said about typhoid outbreak. When the vaccination stopped, we had a typhoid outbreak. And of course, they are say vaccination policy also should be rational. This is an outbreak we investigated. There were more than 150, 170 cases of rubella in the cadets of NDA, that is 17, 18-year-old youth. I have been telling before that for a couple of decades that we started the rubella vaccine in childhood without. I had my concern that rubella is a childhood disease. If we just vaccinate the children without, there would be an epidemiological shift into adult age, and that would be childbearing age. Otherwise, you get rubella, you are free with it. In childhood, it's very mild. Pregnant women, so that exactly happened in NDA. So we don't know how many congenital rubella also must be occurring due to the epidemiological shift of rubella due to childhood vaccination. So that's why vaccination strategy has to be scientifically thought out. Like, can we cover the adult population? Now we are trying to cover rubella and all. Do we cover the healthcare worker with rubella vaccine? Because healthcare worker will be examining so many pregnant women. If they are having rubella is very, very mild. One doesn't know even one gets infected. Few rashes and all, which will go as drug rashes and they can. So we are losing out on important vaccines like rubella for healthcare workers in other countries they're having. So we have to rethink our vaccination strategies and focused on the risk group or the occupational group. So that's all I think I have. So I have finished. I can take a few questions. I can, I think, stop sharing. Thank you.
Thank you so much, sir, for the comprehensive talk. Sir, we have received few questions from our participating doctors. May I have your permission to present them?
Please do.
Okay, sir.
Okay, this is a very, we have smallpox. We have the example in front of us. Was a smallpox vaccine we have rolled back. We don't have any smallpox vaccination because we can do it once the disease is eradicated. There is no, not a single case present and no reservoir present also. But there are some diseases which we can eradicate and we can roll back the vaccine. There are others which we cannot, like tetanus. Tetanus, we can never think of rolling back the vaccine because tetanus is present in the soil, horse dung, cow dung, and we are always there is always an accident can take place and we can get infected with it. So we have to see the epidemiology of the infection, whether smallpox we could do it because there was no extra human reservoir. There were only humans could carry the virus, so we could easy. Once there is an animal reservoir, it's difficult. Like plague, we cannot eradicate. We don't come in contact with. We cannot eradicate any by say Nipah and all this monkeypox because they will be in the wildlife. We cannot reach the wild. We cannot eradicate rabies. So it depends on the epidemiology. Measles we can eradicate because there is no extra human. In fact, we should have gone for measles eradication before polio eradication because polio is difficult to eradicate because there are large number of subclinical cases. Smallpox did not have subclinical cases. Measles did not have subclinical cases, asymptomatic infections. So it depends on the disease, and we have smallpox, we have rolled back. It's also which will it will require sustained efforts. You see, and particularly very rightly you said low and middle income countries. Like even if we say that sanitation and good standard of living can eliminate the need for vaccines, but low and middle income countries, the marginalized groups, people living in overcrowded conditions, malnourished children. In fact, measles is 400 times more lethal in a malnourished child than in a normal child. So we have to maintain sustained vaccination, and for that, as Hafsa said in the beginning, we require the community health workers reaching out to every vulnerable child, every vulnerable family, and we require a lot of one-to-one contact, personal, and with good information. So that is it's an ongoing thing. It's and we have to then, as I said, we are getting a lot of vaccines which are we are adding up actually. It's something like I am seeing the new MBBS syllabus. We keep on adding subjects and we do not remove, and we are overburdening the medical students. Similarly, we are overburdening the child with too many vaccines. We have to think can we prioritize the which are the essential vaccines and which are optional, which are need to know, desirable to know, but which are the essentials. So we should go for the essential vaccines, which will depend on each country's morbidity and mortality data, which is the disease, vaccine preventable disease, which is taking the maximum toll. So we have to, the epidemiologists, the policymakers, the vaccine scientists, they have to work together. Unfortunately, presently, everybody is working in silos. They are working, any vaccine is manufactured, the vaccine scientist works on it, may get a Nobel Prize also, and goes to the manufacturer. And once it is manufactured, you have to roll it out blindly. It should not be like that. There should be a joint decision with the epidemiologists, with the public health people, social scientists to identify the priority in the community so that we can do focused and save our resources also, and we reach the maximum bang for the money. So each country will have its own priorities. Thank you. It's very costly. Long-term economic implications are very costly, and that's why we should go for focused vaccination. We have to work out the economics. Sometimes we duplicate unnecessarily and increase the burden. Like in this pandemic, we even those who had recovered, who had natural infection, even this tennis player was forced to take a vaccine. He did not take, of course, the Jovic or Nojovic who did not. And but other lesser mortals, even those who had recovered, and in fact, before our vaccination campaign started, 60 to 80% of our population had recovered from the natural infection, which gives good immunity. So this and giving vaccine to them is forget about the side effects. They were at a huge economic cost. So this was not money, health economic, good. And then the other terms come up, hybrid immunity and other things. It's not known. What do you mean by hybrid immunity? There can be immune exhaustion also if you are. So again, that's why, as Plotkin and his authors said, co-authors, that we require study. We cannot just coin new words, hybrid immunity, immunity without any studies. So, economic implications will be very high if we leave it to the stakeholders who have got conflicts of interest. Unfortunately, what's happening more and more lobbying, and we are surrendering to the pharma pressure and political pressure and the commercial pressure. So, it will be at huge economic cost. And if you see recently, last week, Canadian government destroyed millions of doses of COVID-19 vaccine because they had over manufactured and the strain has changed and all that sort of thing. So, I mean, it is bad health economics if we do not plan in a scientific and in a interdisciplinary way with epidemiologists, with scientists, with manufacturers should be kept aside actually, but unfortunately they are taking center stage now. So I think it's a no easy answers.
Thank you so much, sir, for answering all the queries of the doctor. We believe it was an insightful and lucid presentation. Thank you once again for your time and coordination. Now, I would like to request the audience doctor here if they can suggest any other topics based on this session or on our doctor specialty. Lastly, before ending the live, I would like to request you all to follow us on our Facebook, Instagram, LinkedIn, and Twitter pages to stay updated on more medical infos. Therefore, with all you do permission, sir, can we bring this session to an end?
Yes, thank you. It was a pleasure. Thank you.
Thank you, sir. Have a good night.
Thank you.